Over the past 20 years, the people living with diabetes in the United States has more than doubled. My name is Ethan Leiker. I'm a pharmacy resident here at Salina Regional Health Center.
Let's talk about diabetes management and why it's important for diabetes patients to really be active in their disease process.
So as a pharmacist, the big thing I look at is diabetes patients, people with diabetes, they have twice the medical costs than do a person without diabetes.
Okay.
And as a pharmacist, it's kind of my job to reduce those costs and make it a little bit easier for them to afford that. We also have 34 million people in the United States who are diabetic, and 1 in 5 don't even know they have diabetes. And on top of that, they're on multiple different medications. Oral medications can be taken 1, 2, 3 times a day, and then they can be on multiple injections that can be from weekly, once a week, to 3 to 4 times a day with meals. And there's a lot of side effects and a lot of blood glucose control that we look at while taking these medications and managing our diabetes.
One tool that you guys have developed or started for the diabetic patients is the support group. Why don't you talk about the diabetes support group at Salina Regional?
So the diabetes support group was started in 2016 by a couple of pharmacy residents who are now pharmacists at Salina Regional and help us with the program. What it is we just have specialists come in. We've had podiatrists, neurologists, diabetes educators, dietitians, really any sort of healthcare professional that has an interest in diabetes come in and talk about the disease state and give us tips on how to manage and how to better deal with being diabetic. And then since COVID has happened, we've kind of had to change the formatting. We can no longer have in-person meetings, and we kind of lost out on the informal discussion and the questions that would happen at the end. But now we give everyone an opportunity to see these pre-recorded videos from the same specialists we would have had before, and then they can email us at diabetessupportgroup.com, at srhc.com, to ask any questions, recommend any topics, or just make comments on how the video went for them.
Why don't you talk about some of the topics that you've had so far since you've gone to the virtual meetings?
So the virtual meetings have covered sick day planning, and that was with one of my co-pharmacy residents. We had a doctor come in and he talked about what to bring to your doctor's visits, how to better prepare for your doctor's visits, and gave us a couple of handouts that we can use to give our doctor an idea of what our day-to-day life is like. We've had a chaplain come in and talk about our mental and spiritual well-being along with diabetes, how that can affect our blood sugar. And then our last meeting, I talked about how diabetes medications work and kind of some of the side effects and what to look out for with them.
Thank you so much for being on the show. And thank you for watching. For more information, please visit srhc.com, like us on Facebook, follow us on Twitter, and for information on the Diabetes Support Group, email them at diabetessupportgroup@srhc.com.